There is nothing worse than no-shows and cancellations to destroy your physical therapy business profit margin. Hey guys, if you don't know me, my name's Tony Maritato. I'm a licensed physical therapist and owner of Total Therapy Solutions. So we've been in private practice officially since 2002. That's over 20 years of history. And over that time, we've learned a lot of lessons. We've made a lot of mistakes. But in this video, I want to share my 3 strategies for you to reduce cancellations and no-shows. And it's not the stuff you've all been hearing. It's not send them a text message, call them. Those are good strategies. I'm not against those. I don't see those really making a material difference. Tip number 1 is change the market demographic. If you're dealing with a high level of cancellations and no-shows, it's possible that you're just not treating a patient population that has high urgency, that puts your service at the top of their priority list. Option number 2 is to create systems so that when you do have a cancellation or no-show, because it is inevitable, you have a way to recover what would have been a missed appointment. So for example, in my clinic, we have about 2,000 square feet. We're not a high volume clinic. So we have what's called a maintenance program, non-covered maintenance program. We offer access memberships. This basically means that when a patient has finished formal physical therapy, rehabilitative therapy, but they have a genuine need for continuation of services, but these services are generally not covered by their insurance plan, we offer them an access membership with intermittent covered maintenance sessions. So an access membership could be $30 a month, $100 a month. Honestly, the price doesn't matter because this is not a major revenue source. The real value in this is having hand-selected people in your clinic every hour of the day so that if you do get a cancellation and somebody is participating in a program like this, you can reactivate them right then and there to do a covered maintenance session. Maybe you haven't seen that patient on a billable visit for 2 or 3 months, maybe even 30 days. And now it's time for them to get a little progress report, update their programming, see what they're doing well, see what they're still struggling with, maybe update goals related to a formal maintenance program. So what would have been a completely missed appointment now turns into a recovery session for somebody who's in the clinic already, and it takes very little effort to turn that into a monetized visit. The third option in reducing your cancellation and no-show rate is sitting down and having an honest and genuine discussion with your therapist. Either it's you, who, if you're the only therapist working in your practice, that's reasonable. You have to do a little self-analysis, or it's your staff, it's your team, and really getting to the root of how much do they prioritize their plans of care? How impactful and important is it for a patient to be compliant? I know for myself, if I'm treating somebody that has low back pain, non-traumatic, insidious onset, long history of low back pain, and when I look at the overall plan of care, I realize that while this is a condition that needs to be resolved, it's also not a condition that's significantly impacting my patient's life. They're still driving, they're still dressing, bathing, feeding, grooming, they're still doing all of the things of personal self-care. They're still active in the community. They're even still participating in recreational activities. It's just a nuisance problem, not a debilitating problem. And so when I look at a plan of care like that, as the physical therapist myself, one of the things that I realize is I don't place a high priority on the patient's recovery. That means I don't really think it's all that important for them to comply with the prescribed physical therapy plan of care. So if a patient misses an appointment because they want to go do something that's more fun, me as the therapist, my personality is, I tend to encourage that. But if I'm the employer, obviously that creates problems. And so I think it's important that you sit down with any of your clinical team, PTs, PTAs, OTs, CODAs, and you have an honest discussion about this. Because if your therapy staff is not prioritizing the plan of care and compliance with the plan of care, then you have some hard decisions that need to be made, because that is going to materially impact the profitability of your business and the sustainability of your business. I hope those 3 tips were helpful. I would love to hear from you. What has been your best way to reduce cancellations and no-shows for your practice?